My name is Laura Kelsey. I'm a board certified general surgeon practicing at Center for Vein Restoration in Grand Rapids and in Muskegon. So I chose vein care as a specialty a long time ago. My mentor was Harori Hasuna, and her claim to fame was as a hematologist. She patented factor V Leiden and protein CNS. And those are common clotting abnormalities that were just discovered in the time I was in medical school. So over my second and third year, we had a few months off, and she sent me to Hawaii to work with the founding fathers of vein disease, actually. So they started the American Venous Forum, and that was my early exposure to vein disease. Dr. Kistner would take the veins out, and I would count the valves in the saphenous vein. And so that was an early exposure as a medical student. And then the following year, I was able to present on protein CNS deficiencies, factor V Leiden, at an international conference in Bulgaria. And then my fourth year of medical school, I went and studied thrombotic states in London at St. George's Hospital. So I had an early introduction, and my mentor was a hematologist, and she wanted me to go into hematology, but I wanted to do surgery. So then in surgery, I wrote an article on how to prevent blood clots in high-risk patients, and it was published in the hematology journals, and then looked at the role of inner IVC filters, vena cava filters, and their role in post-thrombotic syndrome. And then I went into general surgery instead of vascular surgery, because at the time there wasn't a lot of additional curriculum that would be gleaned from doing a vascular fellowship. It was heavily weighted towards arterial disease. I think every time we're invited to participate in the care of our patients, it's a privilege, honestly. And whether my job is to counsel them on blood clotting disorders or treatment of blood clots, pelvic congestion, treat their varicose veins or lymphedema, I really feel that it's an opportunity for me to help facilitate their wellness. And that's how I look at healthcare. Some people need me to be a surgeon, and some people need me to listen, and some people need me to redirect. And so my philosophy is that I hope every day that I can rise to that challenge and be what patients need me to be. When we look at wellness, I think it's a lot more than just the delivery of healthcare. And it's hard to be part of a community without recognizing the needs in that community. So in Muskegon County, for example, over 75% of the children live below the poverty line. And so there are two main opportunities for me here to help. One is the Kids Food Basket. I was a co-chair of the capital campaign to raise money to build a new facility to help provide food after school for kids in need. And then a good friend of mine does the fundraising for the Boys and Girls Club of Muskegon too. And they just built a new facility. So we were a corporate sponsor at their most recent event. I think that it's hard to talk about wellness in isolation. And so I think our future is our children. And so I'm happy to use our time and talents to help facilitate that here. In addition, I think education is paramount. And so I was offered an opportunity years ago to participate in the Alumni Association for College of Human Medicine, and then later became their president. During that opportunity, we were able to raise funds to help scholarships for medical students. Michigan State's mission also is to really help facilitate education for those who otherwise didn't have it. That's the philosophy of the whole college. And then the medical school in particular has a focus on making healthcare accessible, but also affordable to the students. And so I was really excited to be part of their Empower MSU campaign. I think that was $1.4 billion that was raised to facilitate that for these students that wouldn't otherwise have gone to college, or first generation college students. So I think we have to look at who's providing the care and how do we get the funds to provide that care. And again, being part of that and meeting people that have deeper pockets, obviously, but with knowledge, again, most of the people in our community are very generous. And once they're aware of the needs, they're very receptive to that. So my job was a facilitator of that in these organizations. What's unique to me is I'm a general surgeon. So I have a lot of surgical skills. But I think what's more unique to me is the background that brought me to the vein disease specifically. So rather than choosing it as a subspecialty after doing general surgery, I feel like my whole medical career was grooming me for this position. For example, being mentored by someone that understands thrombophilia so well has given me a unique perspective and inside look at blood clotting disorders. And so one of the things that I do differently than other vein practices potentially is I focus on that. I feel very comfortable addressing blood clots, helping solve the riddle of where did this come from, what's long-term anticoagulation look like. And I think that's a real benefit in addition to doing treatments, is solving a problem that is a life-threatening problem. You know, they say that varicose veins affects 50% of people by age 50, but it's not usually a killer of patients like blood clots are. So I think that's a unique perspective that I bring, is that we offer a full service to our patients and to the providers in the community. So this past year, I was really fortunate. I was nominated for AOA for the Alumni Association for Michigan State College of Human Medicine. I was also featured in Women in Medicine for the college. So that was a nice platform to get on stage with other women and talk about our experience and our journey through, navigating our careers and family. So that was a real nice opportunity for me. And then at Center for Vein Restoration, every year they have a President's Award. And this year I was the recipient of that. So this past year has been nice. What I would like patients to know about me is they give me so much more than I give them. And I really look at each opportunity as a privilege. And so one of my mentors told me that if you can just let patients talk, they'll tell you what they need. And I hope that my patients know that I'm going to work with that, anticipating that you're going to tell me something that you need, and I'm going to help rise to that challenge. I want the referring physicians to know our skill set, that we are trying to provide competent care in vein disease in the context of the patient's overall wellness and health. And I want our referring providers to understand that if I don't think the vein disease is the prominent issue, I will be glad to redirect them. Not every patient who has varicose veins needs a surgery, but everybody with varicose veins deserves an opportunity to have that assessed and determine what the proper management strategies are. And so the other thing I want our referring providers to know is that if they don't have a varicose vein problem, we're not just going to rush them out of the room. We're going to look at the other things that could be causing their disease state. For example, if a patient comes in with a blood clot, we're going to provide counsel for that blood clot, even though it doesn't necessarily mean a treatment from a surgical perspective. If they come in with a swollen leg and they need lymphedema therapy, we will help facilitate that therapy for them and follow up with them and make sure that those needs are addressed too. So it's not just do they need surgery, it's what do they need and how can we help facilitate that for the patient.